Hey everyone, happy 2022. My name is Sibin. I'm a pharmacist currently working in mental health, and today I thought I'd talk about a topic that may not necessarily be top of mind, but definitely requires some attention as our healthcare continues to evolve. Which brings me to the topic of psychedelics, but more importantly, the need for pharmacists to raise their voice and have a seat at the table as psychedelics become more prevalent in healthcare. So if that sounds interesting, let's talk about it. What exactly are psychedelics? Psychedelics refer to a loosely grouped class of psychoactive substances that work very differently than our current available psychiatric medications. If we take the word psychedelic, it's derived from the Greek word psyche, meaning soul or mind, and delos, meaning manifest. So taken together, psychedelic meaning mind manifesting. Some examples of psychedelics include psilocybin, found in certain species of mushrooms, lysergic acid diethylamide, also known as LSD, ibogaine, and dimethyltryptamine, commonly known as DMT. Another medication to make note of is MDMA, recreationally known as Molly or ecstasy. While this isn't always considered a psychedelic, I'm including it here because we'll be coming back to this later. When we talk about some of the effects associated with psychedelics, they can vary quite a bit, with people often experiencing altered sensory perceptions, mood, and cognitive processes. People have reported feeling an altered perception of time, a blending of sensory experiences, so this could include seeing sounds, also known as synesthesia, complex visual fractal patterns, and inducing non-ordinary states of consciousness. The effects of psychedelics can vary depending on the specific psychedelic used, and similar to other medications, the dose plays a large factor in the psychedelic experience. But unlike other medications, the individual's mindset as well as the environment can significantly influence the psychedelic experience. These changes in perception and mood can actually be disorienting for some people, and it's for this reason that psychedelics have long been associated with needing a proper set and setting. Set being the mental state a person brings, like their thoughts, moods, and expectations, as well as the setting, which is the physical and social environment of the person. Where exactly did psychedelics come from? So our earth is full of plants that contain psychoactive compounds, some examples including peyote, cactus found in northern Mexico, certain species of mushrooms, and ayahuasca, which is a liquid brew that's found in South America among the Amazon. When we take a look back in history, we come to learn that many cultures from around the world use psychoactive plants in a sacred or spiritual context for thousands of years. And then in 1938, a Swiss chemist by the name of Albert Hofmann, who was an employee of Sandoz, a Swiss chemical company, was working with ergot, which is a fungus that attacks rye grain. It was at this time where he first synthesized lysergic acid diethylamide, commonly referred to as LSD. Now, many people vaguely remember that LSD and other psychedelic drugs were once used experimentally in psychiatry, but few people realize how much and how long they were actually researched. Between the 1950s and 60s, there were more than 1,000 clinical papers discussing over 40,000 patients, as well as 6 international conferences. At one point, LSD was the most studied psychiatric drug in the world. Some of the conditions where LSD was being researched include anxiety, depression, psychosomatic diseases. It was actually the tryptamine component of the chemical structure of LSD that many people argue catalyzed the whole field of serotonin neuroscience. So if these psychedelics have been used by indigenous cultures for thousands of years, clinical trials were conducted in the 1950s, what exactly happened? Well, it wasn't long for LSD to escape the lab setting and made its way to recreational use. The anti-war attitudes and rejection of conventional social norms by the adolescent and college students were perceived to be the result of drug use, specifically psychedelics. And so this radical questioning of the government didn't really sit well for authorities. And in 1970, President Nixon introduced the Controlled Substances Act, placing LSD and other psychedelic drugs known at the time in the most restrictive category of drugs known as Schedule 1. And so this classification made them virtually impossible to study, and any significant research into the pharmacology and medical value were basically lost for over 30 years. A Schedule 1 substance is defined as a substance with high potential for abuse and no currently accepted medical use in treatment. But in 2018, a group of scientists published a manuscript in Neuropharmacology evaluating the abuse potential of medically administered psilocybin. They followed the structure that the US used in developing violating the US Controlled Substances Act. And in the figure, drugs were rated using a multi-dimensional scale, ranking them from overall harm from the left being the most harmful to the right, which was least harmful. And as you can see, mushrooms, referring to psilocybin containing mushrooms, was considered the least harmful. Now, a quick look on clinicaltrials.gov shows us that there's about 38 active or recruiting trials looking into psychedelics. Now, many institutions such as Johns Hopkins, UC Berkeley, as well as the School of Medicine at Mount Sinai open centers devoted to studying psychedelics. In 2018, the FDA granted FDA breakthrough designation to 2 companies that are using psilocybin in their clinical development programs. USONA Institute receiving the designation for its use in major depressive disorder, and Compass Pathways for treatment-resistant depression. And so this FDA breakthrough designation expedites the development and review of drugs intended to treat serious conditions where the preliminary clinical evidence demonstrates substantial improvement over currently available therapies. FDA also gave MDMA-assisted psychotherapy for PTSD as a breakthrough designation as well. It is likely that MDMA will be FDA-approved medication by the end of 2023. Now, in a country where mental health is one of the fastest growing health problems we face today, these types of breakthrough therapy designations are a strong endorsement for the potential of these psychedelic medications. And one of the reasons psychedelics are having their moment in science is because we're now able to also see what's happening in the brain through brain imaging technology. Preclinical research has shown that psychedelics can induce molecular and cellular adaptations related to neuroplasticity. Neuroplasticity can be defined as the brain's ability to adapt to different types of circumstances, which is necessary for healthy brain function. Now, of course, while more research is needed, this neuroplasticity that's seen with psychedelics may actually help explain some of the clinical effects we see. So what exactly does this have to do with pharmacists? A number of US cities and states have taken steps toward effective decriminalization, loosening the consequences and criminal penalties for personal or therapeutic use of these substances. So some of these cities include Denver, Oakland, Santa Cruz, Ann Arbor, Somerville, and Northampton. But even more relevant, starting in 2023, the state of Oregon will actually allow the safe consumption of psychedelics for treatment use. In 2020, Measure 109 created a program for administering psilocybin products, such as psilocybin-producing mushrooms and fungi, to individuals aged 21 years and older. Clients would be allowed to purchase, possess, and consume psilocybin at treatment centers under the supervision of an approved facilitator. Now, this basically means that people will be able to legally consume psychedelic medications in the US. This starts in January 2023. It's important to understand how these things work so that you can educate your patients and mitigate risk. And so what's going to be our role in all this? Well, these psychedelic drugs will have various chemical properties, effects, and interactions, just like other prescription medications. So pharmacists will need to be able to critically assess the appropriateness of patient prescription and non-prescription medications, as well as suggest any appropriate interventions. A recent study was published looking at MDMA-assisted psychotherapy, which demonstrates a statistically significant difference in the treatment response in patients that had tapered off their antidepressants compared to patients that were not on antidepressants in the first place. Now, this would suggest that a longer taper may be necessary for a better therapeutic effect, which is exactly where pharmacists have the opportunity to make an intervention and help these patients taper their other medications for an adequate amount of time. Pharmacists are uniquely positioned to really be the expert regarding tapering strategies based on the drug's information like half-life, pharmacokinetics, and pharmacodynamics. This information will be critical for psychiatric pharmacists, who are pharmacists that have completed specialized training in psychiatry, but these types of interventions will also be necessary in the community setting as well. And as we've seen over the past 2 years, the community pharmacist has provided critical health services, seeing patients every single day of the week, and oftentimes without an appointment. And another area where pharmacists can bring tremendous value has to do with minimizing side effects and understanding drug interactions. A study was recently published illustrating how escitalopram pre-treatment had no relevant effect on the positive mood effects of psilocybin, but significantly reduced the negative drug effects, anxiety, and adverse cardiovascular effects compared to placebo. As with any clinical trial, there are study limitations, but the fact that there are well-designed trials with relevant information for patients is itself an opportunity for pharmacists to keep up to date with ongoing research and provide value to the profession. And so this is just referring to other psychotropics. It is fairly common for people to be on a variety of different medications that can interact with psychedelics, highlighting the importance of bringing pharmacists to this table so that we can understand how these will integrate with our current available medications. Now, it is likely that there will be a risk evaluation mitigation strategy, which is also known as a REMS program. And this means that there will be rules around medical use in the clinical setting, and pharmacists will be involved in the same ways we think of reporting adverse drug reactions, drug-drug interactions, and it will likely be REMS specialty pharmacies dispensing these medications to the clinics. At the end of the day, all I'm really here to do is advocate for greater pharmacist involvement in the psychedelic assisted therapy model of care. The role of the pharmacist in public health has been expanding over the past few years. Pharmacists have been able to administer a variety of different vaccines, such as COVID, shingles, hepatitis A and hepatitis B vaccines, and even in some cases, long-acting antipsychotics. Also in certain states, pharmacists actually have the authority to recommend and prescribe routine medications like smoking cessation agents, as well as oral contraceptives. So this trend is only continuing to expand as the need for accessible and affordable healthcare continues to grow, and this untapped resource of providers is being recognized. For many years, there are a number of pharmacists that work together with physicians through something known as a collaborative practice agreement, which actually allows pharmacists to perform different patient assessments, order and interpret laboratory tests, and even prescribe certain medications. For those in healthcare, it's well known that the shortage of primary care physicians continues to increase, with the Association of American Medical Colleges, AAM, expecting a shortage of up to 121,000 physicians, which include both primary and specialty care, with reasons including physician burnout, an aging population, and retiring physicians. And so if you don't already know, by 2033, it is expected that the over 65 population will grow by 45%. Pharmacists are well positioned to really integrate as primary care type providers, especially as the healthcare industry shifts away from a reimbursement structure based on volume towards a reimbursement structure based on value. So as a pharmacist, what can you do to, prepare for this? The simplest and easiest way is to really just to start reading. There's a plethora of information that's available from published articles, books. You could watch educational videos, anything that helps cultivate a bit of curiosity. And then if you're interested in further training or getting some sort of certification, there are a number of different psychedelic therapy certificate programs that you can apply to as well. And if this is something that you'd like to proceed with, I do recommend basing your choice on what makes the most sense to you. Some of the factors may include the syllabus and faculty of the program, the length of the program, or the tuition. There also are a number of organizations that you can get involved with, such as the Psychedelic Medicine Association, the Psychedelic Pharmacists Association, MAPS, which is the Multidisciplinary Association for Psychedelic Studies, as well as many other regional organizations. So if you're a pharmacist with an interest in psychedelics, understand that there is still quite a bit of stigma associated with psychedelics, but as healthcare professionals with strong scientific acumen and clinical experience, pharmacists are well equipped with providing education and help inform the public about the risks and benefits associated with these unique medications. So at the end of the day, if you're a pharmacist with an interest in psychedelics, you have to be an advocate for yourself, because if you don't, who else will? Thank you for watching. Catch you guys in the next video.